Hi, I'm Maria Pearson with HGI Senior Solutions, here today to go over Medicare 101. Joining me is also Lorraine Lewis of HGI Solutions.
Hello.
Welcome, Lorraine.
Hello, thank you.
And she'll be joining us together here in a few slides to go over some of the content as well. For now, I will go ahead and just get started on the material. So what is Medicare? Medicare is a federal health insurance program. It is available to people who are turning 65. It is also available to people with certain disabilities. So for instance, if someone has end-stage renal disease, they will qualify for Medicare, or if someone is receiving a Social Security disability check for at least 24 months, they will become Medicare eligible as well, okay? So typically under 65, it would be due to disability, but also people do qualify automatically at 65 as well. Now, I want to cover a little bit on the difference between Medicare and Medicaid because people get those confused. An easy way to think about it is Medicaid is aid for those who lack resources and income, okay? So in order to qualify for Medicaid, you would lack certain amounts of income, okay? And then resources available to you to meet your medical needs, okay? Someone can be Medicare and Medicaid eligible both at the same time. And then there are certain plans available for those people, okay? Do keep in mind Medicare is not asset or income based to qualify, but your income can affect how much you pay for your Medicare, okay? We'll go into that detail a little bit later. So Medicare, Medicaid, they are not the same thing. We are going to be covering Medicare today. Part A and B are original Medicare. They've been around for over 60 years. Part A covers your hospitalization and Part B covers your medical care needs, okay? So things like doctors and outpatient procedures. So this is what you would enroll in when they talk about original Medicare. When you go to transition to Medicare, no matter what, you need to enroll in Part A and Part B. Now, Part A, the hospital coverage, does have a $0 premium, okay? It's $0 as long as you worked and paid your Medicare taxes for at least 40 quarters. However, if you get admitted to the hospital, it is not free. You are going to pay costs. So the first 60 days in the hospital will cost you up to $1,676, okay? So whether you're admitted one night or 60 nights, you're going to pay $1,676. If you are still in the hospital on day 61, you start paying a per day copay of $419 a day. And that is your copay per day for the next 30 days. Then day 91, you have a copay of $838 a day. And that is your cost for the next 60 days. So days 91 through 150 are what they refer to as lifetime reserve days. So they'll work very hard to get you out by day 90. If you did say have a hospital stay for 100 days, you use 10 of them, you have 50 days left to use later in life beyond a 90th day in the hospital. Okay. Part A does also cover hospice care, and they cover it very, very well. They cover blood as far as transfusions, but you have to pay for your first 3 pints every calendar year. And then keep in mind, Medicare Part A will potentially cover 100 days of skilled nursing. Those 100 days are broken down to very good coverage for the first 20, where you pay no cost. And then days 21 through 100, you would have a copay of $219 and 50 cents a day. Medicare is not designed to cover chronic long-term care needs. Okay, that would be covered through things like Medicaid private pay or long-term care insurance. But if you've been in the hospital 3 days, you go directly to skilled nursing, Medicare will cover a portion of that cost for you as long as you continue to improve. So that sums up coverage under Part A hospital. Part B, the medical insurance, you do pay a premium of $185 a month. I do have a note here that says IRMA, that stands for Income Related Monthly Adjustment Amount. I mentioned that your income can affect your cost under Medicare, and this is where it counts. So if you have higher income than $216,000 2 years ago, then you will pay more for your Medicare Part B insurance. And there's a graduated chart for that. And I do apologize, that amount is for a joint tax filer, an individual more than 108,000. Okay. So they always look at your income 2 years prior. So right now we're in 2025, they would be looking at 2023 income. Okay. If you were to have an IRMA charge, you'll get a letter from Social Security letting you know what that amount will be. Now, you do have an annual deductible under Part B of $257. That's a yearly deductible, as I said, annual amount. You pay that first $257, then Medicare begins paying 80%, and you would be responsible for 20%. You do need to know there is no out-of-pocket maximum limit to your 20% that you would pay. Things like your doctor visits, whether it be a primary or a specialist visit, are covered under Part B. Labs, things like chemotherapy, immunotherapy, physical therapy, all of those typical outpatient procedures, surgeries, they're all covered under Part B. Now, there is a possible penalty under Part B that you would pay if you do not pick up Part B and you have not had qualifying coverage, okay? If you are working and you have an employer plan, you will avoid the Part B penalty. But if you retire and you do not pick up Part B within 8 months, you will end up facing a penalty. So it's very important to understand your enrollment period to pick up Part B. We'll go over the details and the timeline later for that time period. But just know, if you don't take steps when you are first eligible or losing employer coverage, then you could pay a penalty. Okay? So the way to avoid it, stay on that employer plan, and when you retire, make sure you get transitioned to Medicare. Okay? So that summarizes original Medicare A and B. Moving forward, I want to talk about how do you enroll in A and B. So A and B is enrolled in through Social Security. Okay. Social Security will take care of your application. They will confirm your eligibility. Okay. Your eligibility will be based on your age, loss of employer coverage. Maybe it's based on disability for you. Okay. You also get your Part A for 0 as long as you have 40 quarters of qualified work. So Social Security will verify that information to determine if you need to pay anything for your Part A. You also need to know you can't apply more than 3 months prior to your desired effective date. Okay? And it can only begin on the first of a month. It is going to start for you on the first of the month that you turn 65, unless you decide to put it off until beyond retirement. Okay. Now, if you are taking Social Security, you will automatically receive your Medicare card 3 months prior to the month of your 65th birthday. They will automatically have you signed up for A and B. If you are still working and on an employer plan, then you may want to drop your Part B coverage. It will all depend on the size of the employer that you work for, okay? So the advice I would have for you is set up an online SSA.gov account now. Doesn't matter your age, get that set up for yourself so that you will be ready to go when you are deciding to pick up Medicare. Now, you can also apply at the Social Security office if you don't want to do an online application, and you can set up a phone appointment with Social Security to do this as well. Now, the phone appointments are roughly about 40 days out, so you need to plan ahead so that you have your Medicare number in time to transition completely if you plan to move to Medicare entirely at 65. Okay, so keep in mind online, you can go to enroll in your Medicare A and B. You can also set up a phone appointment, or you can go to your local Social Security office. Okay. If anyone needs instructions on how to do this enrollment, let us know. We do have the instructions written out for you. Now, a couple things I want to get into now are when you may or may not want to sign up for Medicare. So first off, don't sign up for Part A or B if you are still employed with a company who has more than 20 employees. So if you plan to work beyond age 65, you don't necessarily have to pick up A or B at all. And you especially do not want to if you're contributing to a health savings account. Once you sign up for Part A, any HSA contributions you make will become taxable. Okay, so there can be repercussions for that. Eventually, you could even pay a penalty. So don't sign up for A or B. If you are still working, you're over 65, and you're contributing to a health savings account. Now, only sign up for Part A if your company has more than 20 employees, but you are not contributing to a health savings account. Okay, then you would want to go ahead and pick up Part A, get that Medicare number. It will make your transition to Medicare much easier later on. Okay, so only pick up Part A in this scenario where you're on an employer plan and not contributing to a health savings account. Now, you do want to make sure you sign up for A and B if you're retired and turning 65, if you're 65 or over and you're retiring, if you're still employed, but your employer has fewer than 20 employees. At that point, Medicare becomes primary payer, so you will need to pick up A and B in this scenario. Now, the same thing applies if you're under 65 and you are eligible by reason of disability, but the employer has fewer than 100 employees. Then you would want to make sure that you sign up for your A and B both. Okay, so don't sign up for A or B, only sign up for Part A, or sign up for both. These are the general rules you need to be aware of. Okay, and again, if you need more customized information for you, we'll make sure you have our contact information at the end of the presentation. Now, I mentioned before, Part A does not like HSA. So once you're enrolled in Part A, any HSA contributions that you make over the limit, they do become subject to tax. And if you continue to contribute longer than the calendar year, you will also pay a 6% penalty. Okay, it does get assessed when you file your taxes. So keep in mind, if you are not taking Social Security, you do not have to sign up for Part A, okay? But if you are taking Social Security, they require you to take at least Part A, okay? So if you have Part A Medicare, it does not mean you cannot be on the health savings account style plan at your employer, but you need to be aware of how any contributions will affect you. It really makes sense to stop your own contributions because you don't get the tax advantages any longer, okay? You also need to know if you are retiring beyond 65, and so let's say you decide you retire at full retirement age 67, when you go through the process to pick up Medicare, they will backdate your Part A 6 months. When they backdate that 6 months, that can affect contributions if you have contributed over the limit for that calendar year. So they prorate any amounts you're allowed to contribute. Okay, so keep in mind that they will backdate that 6 months. Now, it's not backdated prior to your 65th birthday, unless, of course, you are eligible by reason of disability. Okay? So, some general rules to keep in mind because Part A does not like HSA. All right, does anyone have any questions? If you do, you can pause for a moment, and otherwise, we're going to go ahead and move on and allow Lorraine to cover the next section of this presentation. Change some things up here. Okay. All right. Thank you, Lorraine. I'll go ahead and I'll be available to switch the slide.
Okay, thank you. Okay. Now, when can I sign up for Medicare? When you first turn 65, you have a window of time known as your initial enrollment period, your IEP. This enrollment period opens up 3 months prior to the month you turn 65, includes the month of your birthday, and 3 months after. If you enroll the 3 months before your 65th birthday, then Part A and B both begin the first day of your birthday month. If you enroll the month of your birthday, or 3 months after your birthday month, then Part B will start the first of the following month. Part A is still dated the first of your birthday month. Your Part B date is what triggers your start date for initial coverage. Also, I want to note, if you're fortunate enough to be born on the first of the month, you are eligible 1 month earlier for Medicare, and your IEP shifts forward. Now let's look at what happens if you delay picking up Medicare beyond age 65 because you are on an employer plan. Your window opens up 3 months before your desired effective date for Part B. Technically, you have up to 8 months following the loss of your employer plan to pick up Part B. However, keep in mind that if you go longer than 63 days without qualifying drug coverage, you will face a Part D penalty. Our recommendation is to start 3 months in advance of losing your employer plan and take care of enrollment into any additional coverage within 2 months of losing that employer plan. You will need to confirm with your employer if you lose your health coverage on the last day you work or the last day of the month you work. Part B can only begin on the first day of a month, and you cannot sign up for retroactive coverage. Okay. In this example, the employee is over age 65 and looking to move to Medicare June 1st. The window opens up on March 1st to submit the employer verification form and Part B enrollment form to the Social Security office. If you have not signed up for Part A, then you must enroll in Part A and B during this window. Have your employer complete the L564 employer verification form a month before your window opens. In this example, that would be in February. It is important to take advantage of the full 3 months due to the delays in processing we have seen with the Social Security office. Now, does anyone have any questions on the initial enrollment period, special enrollment period, when they retire? Okay. Now we will discuss what are my options for full coverage under Medicare. Both options require you to have enrolled in Part A and B. Option 1 is to consider a Medicare supplement, also known as Medigap. This plan is coupled with a Part D for your prescription coverage. Option 2 is a Medicare Advantage plan. Medicare Advantage plans are Part C of Medicare, and they include your prescription drug coverage. Looking at option 1, you would have a Medicare supplement. These have high premiums, but you will have more predictability and flexibility because you can see any doctor that takes Medicare. There is no network of providers. Just make sure your doctor takes Medicare and it will be simple for you. While you will pay higher premiums for option 1, you will also pay less out of pocket for your medical care. You may choose any of the lettered planned options within 6 months of your planned Part B date. Outside of this window, it will require underwriting and acceptance into a plan. Your drug plan will be a separate feature, and I will speak about that shortly, and the best way to determine your drug plan. Now, option 2 is Medicare Advantage Plan, Part C. These plans have low premiums, and if you stay healthy, you won't spend a lot of out-of-pocket for medical care. However, if you have health conditions, you will pay higher out-of-pocket costs. You will have a network of providers, so you need to understand the difference between a preferred provider organization, a PPO, and a health maintenance organization, an HMO. The PPO allows you to see any doctor, only you have to pay more for out-of-network doctors or procedures. The HMO has a specified network and will not pay for any of the medical costs out of the network, except in the case of an emergency or urgent care need. You will have more prior authorizations, and your drug coverage is wrapped into this health plan. Moving forward and explaining more, here are the alphabet soup of Medicare supplement plans. In Indiana, as well as most U.S. states, plans G, N, and high deductible G will give you the best value. Plan G is for the person who wants life easy. It covers all medically necessary care except for your Part D deductible, which is $257 right now. Plan N is similar, only it requires some co-pays up to $20 at your primary doctor, $50 at the emergency room if you are not admitted. You could be subject to excess charges, but only if you opt to see a doctor that does not accept Medicare. The last plan we see some people choose who want to have access to any doctor but do not mind some out of pocket. This is the high deductible G. It requires you pay the first $2,870 toward any Part A hospital or Part B medical claims before the plan will cover any costs. Medicare is still picking up costs, but the supplement carrier does not pick up any cost until you meet the $2,870. Keep in mind, you have 6 months from your Part B date to enroll on a guaranteed basis. There is also no annual opportunity to change your supplement plan. Now, Part D, your prescription drug plan, and I like it because drugs begin with D. Right now, the average cost of a Part D plan is about $46.50 in 2025. They must cover FDA-approved medications, but all plans have their own formulary, which will help determine the cost you pay. The pharmacy you use will affect which plan is best for you as well. There is a tool on Medicare.gov that we use to help you determine the best drug plan for you when you transition to Medicare. There is a penalty that can occur if you do not have qualifying drug coverage for longer than 63 days once you are eligible for Medicare. If you are staying on an employer plan, it allows you to avoid the penalty. You can ask your employer for a Part D credible coverage notice to make sure your drug coverage is helping you avoid that penalty. On the left, I have used the base Part B premium, $185, an average premium for Plan G, $155, and then the average Part D premium. You may have noticed these state male, age 65, non-smoker. Medicare supplement plans are rated based on your age, if you're male or female, smoker or non-smoker, and the carriers are allowed to charge you different premiums. The plan on the right, an example of a high deductible G plan. Plan N that we discussed, which takes care of hospitalization very well, but allows copays at the primary doctor or emergency room, is about $15 to $20 less a month than a Plan G, depending on which carrier you are looking at. Some are as high as $35 to $40 a month in savings. Now, option 2, Medicare Advantage. These are operated by private insurance companies. Some examples would be Anthem, United Healthcare, Humana, IU, Aetna, and some other company names you may not be as familiar with. These plans take overpaying what original Medicare pays. They do not pay the amounts that original Medicare doesn't pay. They will have networks and change each year. If you go this route, you will need to look over your annual notice of change each year. You may change your plan during AEP, your annual enrollment period, which is October 15th through December 7th. One reason people like them is because of the extras they get, like the gym membership, the dental, the vision, the over-the-counter goodies, etc. Now, these premiums are the same for males and females of any age with Medicare Advantage. They are rated based on the county and the zip code a person lives in. In 2025, most people are enrolled in plans running from $0 to $39 a month. Maximum out-of-pocket limits range anywhere from $3,500 to $13,300, depending on whether you are in or out of network. It is important to understand your network and use the supplemental benefits to get the most from these plans. Okay, now Part D penalty. A penalty will be assessed once you are eligible for for Part A original Medicare if a credible drug plan is not in place for a period of 63 days or more. The penalty is 1% of the national average price of a drug plan times the number of months you went without credible drug coverage. It is charged to you once you enroll in the Part D plan or the Medicare Advantage plan with Part D, and the penalty will remain with you for the remainder of the drug plan, for the rest of your life, really.
All right, very good. Thank you, Lorraine. I would say we'll wrap up here and talk about a couple other items. We mostly want to make sure that the annual enrollment period, that you have an understanding of what you can and can't do during that time period. This enrollment period applies after you have transitioned to Medicare, okay? So if you're just looking to retire, you're just turning 65, this period of time does not apply to you. It applies once you are already on Medicare and you are looking to make certain changes. So during the AEP, you can enroll in a Medicare prescription drug plan for the first time. So if you do not have a drug plan at all, you maybe only picked up a supplement or just A and B, you could enroll in a drug plan. You can also switch from one prescription drug plan to another plan. So Lorraine mentioned looking for your annual notice of change. Those get mailed out by the carriers at about October 1 each year. You need to pay attention to what the premium is, what the benefit structure is for you. Is your pharmacy still in network? That type of thing. If everything still looks good, you're happy with what the changes are for the new year, you need to do nothing. But you need to pay attention to that document, okay? You can switch from one plan to another if you're unhappy with the changes. You can also, during AEP, enroll in a Medicare Advantage plan for the first time. So Advantage Plan, Part C of Medicare, you can enroll in an Advantage plan for the first time. So if you've had a Medicare supplement in Part D, or you've only had A and B, you can pick up a Medicare Advantage plan. If you're already on a Medicare Advantage plan, you can switch from one plan to another. So maybe you had Anthem, you want United Healthcare, you want IU Health, you want Kaiser, you want, Aetna. There are multiple carriers available. As a reminder, these are very zip code specific, so that it's going to depend on where you live. Part C and D can be changed during the annual enrollment period, okay? So just want to make sure we emphasize what people can do during that time frame. And then we want to talk about your next steps. So if you're becoming Medicare eligible, what can you do? So you're turning 65, you can sign up for Part A and B, or determine your retirement date. What date do you plan to lose coverage? Make sure you ask your Human Resources Department, when will your coverage end? If it ends on the last day you work and that's the middle of the month, you need to make some arrangements to go ahead and get A and B, and then pick up your other coverage the first of the month following, because you can't overlap those with your employer coverage, okay? So it's important to understand your timeline. If you want to apply for A and B, don't forget that is done through the Social Security office, online, in person, or set up a phone appointment, okay? Those would be your next steps. Now, how can we help at HGI Senior Solutions? So we're licensed and certified Medicare advisors. We can help walk you through your timeline. We help educate you on all aspects of Medicare, and we help you navigate you through your transition, okay? So the timeline can be very confusing for people. I've had people submit paperwork, 4, 5, 6 months in advance. They can't understand why they're not receiving anything. That paperwork just sits there. It never gets processed. It never gets returned to you. You have a 3-month window before your desired effective date. Those are the things we'll make sure you have the appropriate paperwork and you understand your timeline. We'll help review coverage options, tailor them specifically to you. Certain plans are age rated. Of course, we mentioned zip code and county as well. We are an independent agency, so we contract with 12 different carriers. Currently, we have contracts with all the Advantage and Part D carriers. And then we have 12 different supplement plans that we can offer to you, okay? And then we'll help facilitate your enrollment so that you have full health coverage. You avoid all the penalties when you do retire or turn 65. And then we're your resource once you transition to Medicare. If you decide that you need to make a change to your supplement, or you're on an Advantage and maybe you want to have access to a different hospital network, we can help you make that change, okay? So keep in mind, we'll help you with all aspects of Medicare, help you through this difficult transition and take the confusion out of that for you. I promised you earlier some contact information. So you will see here our basic extension and email address. they all go to the 4 of us on our team. So you have Lorraine and I who presented today, then Marlene and Wendy assist as well. And so we're here to work together as a team to make sure you are taken care of, you get to do what you need to do on the timeline applicable to your situation. Okay? So, Lorraine, if you want to come back on, we can see if we have any additional questions here. And then call it a day for everyone. I think everything is good. Thank you, Lorraine. Great job today.
Thank you so much.
All right. We'll talk to everyone later. Have a wonderful day. Bye-bye.
Bye-bye.